Okay, now we'll study the shoulder joints, one of the most important joints. First, about the tab. These joints belong to ball and socket joints. Ball and socket means you see the ball is the head of the humerus. It's like a ball. And socket means the glenoid cavity on the scapula. It's like a socket. All ball and fossa joints. But this ball is very big, but the socket is very small. It's about the tip of it. Then is composition. The composition of the joints has two bones. One is humerus, another one is scapular. And what structure will form the joints? First, on the top of the humerus there is the head. It's the head of humerus. Another one is glenoid cavity of the scapula. Now I will draw on the picture. Here is the head of the humerus. Is articular surface, a very smooth surface, articular surface. It's like a head. And here is glenoid cavity, and it's also a surface, articular surface. And the two surfaces will form the joints. And this surface is a fossa. It's not plain. It's a fossa. And this fossa will covered around the head of humerus. But this fossa or this cavity is not very big. It's only 1/3 of the area of the head. So the head is not totally enclosed by this cavity. So our shoulder joint is very freely. They can move freely because it's not totally enclosed by the cavity, by the fossa. Okay, first is composition. Now is about characteristics of your shoulder joints. The first one, the head is very large and fossa or the glenoid cavity is very small and shallow, not very deep, not very big. It's only 1/3 of the surface of the head. So the shoulder is very free. The second one, this picture is a lateral view of the scapular. You see here is our right scapular, and this is the lateral view. You see it on the right. And where is your glenoid cavity? Now here. This round area is glenoid cavity. It's very smooth articular surface. Now, what's glenoid labrum? Okay, you see here. Around the glenoid cavity, you see the yellow color? And this part. This structure, okay, is a circular structure around the glenoid cavity. This one is labrum. Labrum is a dense fiber tissue and is one special structure of the cavity of the joint. It's like our lip, around your mouth, the lip. And this structure can increase the area of the fossa, articular fossa. At the same time, can deep the depth of this fossa. So this structure can make your shoulder joints stronger, because can increase the area and deep the depth. Okay, and can enclose the head, the more big. A bigger area. Okay, the second structure, a labrum around the glenoid cavity. The third one is the capsule of the shoulder joint is thin and loose. And in this picture, the capsule is cut it off. You can't see it, cut it off, but you should know around the joints. The capsule is very thin. You see the white one is not the capsule. They are tendon around the joints. They are tendon. But capsule is very, very thin and loose. So these shoulder joints is not very strong. Not very strong. So you can move it freely. It's another reason. But some part is strengthened, where you see the superior part. There are many ligaments. You see here, here, and here. The many ligaments. The white one is the ligament, and these ligaments can make the joint strong. Now let's see the first. I change another color. Okay, the green one. Cricohumeral ligament. Crico means cricoid precise here. Here is cricoid precise on scapular. Humeral means humerus. Here's humerus. You see. From cricoid precise to the humerus, there's some ligament. Okay, this ligament can strengthen it on the superior part of the shoulder joint. And at the same time, you see here, there are many other ligaments. Enclose it. And here, there's another ligament. This one is cricoid precise to the acromion. Cricoacromial ligament. All the ligament can round it and strengthen it. Okay? Now let's see the fourth one. Dislocation of shoulder joints usually occurs anterior-inferiorly. Why? Because first, the capsule is very thin and loose, but especially the inferior part is the most poor or the poorest or the loosest. So the dislocation often happens on the inferior and anterior part. Dislocation means the joint from the normal position to another position. It's dislocation. Okay, downwards. The fifth one, within the joints. The lateral view, anterior view. Within the joints, there is a tendon. Of the long height of biceps brachii. Biceps brachii, now you haven't studied about the muscle. It's one muscle in front of our humerus. Okay, I change another color. Okay. In front of the arm, there is the biceps brachii. The bicep means two height. This muscle has two heights. One is the long height, another one is short height. Okay, two muscle. Is a short lateral medial side is short height. The lateral side is long height. Okay, long height. The biceps brachii, and the long height. And you see the white part is the tendon of the long height. It's from where? From here. It's a lateral view of the right shoulder, scapular, lateral view. It's from the supratubercle glenoid. That means here is the glenoid cavity. On the superior border, there is a precise, is a tubercle. And this tendon is from the supratubercle of it. Then go laterally. You see, go laterally, then go downwards, and all the length of the tendon will walk or pass in the capsule of the shoulder. In the capsule, okay? Okay, so the last one is within the shoulder joints, there is a tendon. The tendon is the long height of biceps brachii, you know, okay? Now let's study about the movements of the shoulder joints. Okay, please do it with me with the picture. First, if the upper limb move forwards This one is flexion. And when the upper limb go backwards, it's extension. And when go back continually to the back, we name it hyperextension. Go back again. Hyperextension. Okay? It's flexion and extension. Flexion, move forwards. Extension, move backwards of your arm. The second pair is adduction and abduction. Adduction. First, let's see the abduction. Abduction means the upper limb move laterally. Abduction. And then medially is adduction. Abduction means far away to your body. Adduction means go back to your body. The third one is rotation. What's the rotation? Rotation means the upper limb don't move and all the upper limb can move around axis, the vertical axis, and move medially and move laterally. It's around the vertical axis. Let's draw here. Around the vertical axis and move medially or laterally. Okay, this one with rotation or supination and rotation and supination. Okay, and now the last one is circumduction. Circumduction means the head of humerus don't move, but the distal parts, your fist or your elbow joints, they can move with a circle or with a circle. And this one is circumduction. Okay, circumduction. Okay, it's about joints of shoulder.